Okay, well, thank you to everyone for joining us. My name is Carrie Hopkins-Isles. I'm the Deputy Director for ICU DDR. I know my thing says I'm Kim Johnson, but I'm not. I'm just pretending today. So I am absolutely thrilled to have Dr. Hendree Jones with us today, who is an amazing friend to ICU DDR, as well as a good friend to me. And I'm so glad to have people from around the world joining us. Lots of interest I saw from Philippines and Pakistan and all different places. So we know this is definitely a universal issue. And so we're going to talk today about building strength and resilience during the COVID-19 pandemic, a focus on parents with substance use disorders and their children. And I know that this is a really something that we can use not only during this pandemic, but just times of crisis, which I know that Dr. Jones will discuss. So I'm really grateful to have her. And we were fortunate enough to have, after our last conference, a work group that worked on this kind of document and this kind of topic. And we had people also from around the world in that. So we're doing great work on it. I know that Dr. Jones and other folks are continuing that work. And so that being said, I will give it to you, and I will be here for any questions or technical difficulties.
Thank you so much, Carrie, and thank you to all of the wonderful people that have joined our webinar or that will watch our webinar once it is up on the site. And thank you to ICUDDR, I stumbled over that, ICUDDR, for your just wonderful collaboration and support. I'm very honored and happy to be a tiny cog in of this wonderful large organization. So today I'm going to be talking about, really, I love this focus that you all have on in terms of building strength and resilience during the COVID pandemic. One of the things that my team and I oversee a large drug treatment center for women who are pregnant and or parenting, as well as their children. And it's a dyadic program, which means that we treat mom for the issues that she has. We do it in a trauma responsive way, as well as working with the children to help them heal and thrive. And then we work on that relationship between mother, child, and the family to be able to help everybody reach their full potential. And so as we've been going through this pandemic, it's so easy for all of us to look at what's wrong and you really see all the things that we've lost, which there are a lot of losses. And to honor those losses, to process those losses, and to also find what I call COVID silver linings. So where are those moments of joy? Where are those things that we can say, you know what, this is still good, I'm still here. These are positive things that are happening, and I can find joy. And helping our parents and caregivers find those moments of joy so that they can help their children find those moments of joy is just incredibly essential during this pandemic and beyond the pandemic. So hopefully there's some lessons that we can learn from this huge world adversity that we're all facing collectively so that we can be stronger on the other side when we come out. Let's see if I can move my slides. Any thoughts about how they might be able to move, Carrie?
Let's see. Sometimes what happens for me is I end up moving my mouse away, and then I have to come back and make sure I'm getting the screen going. But
yeah, I know that's that is really strange.
Did it move?
No. Can you see it? I'm gonna try escaping out of it, and maybe it'll move that way. No. Oh, you know what? It still says it's building.
Oh, weird. Because I was actually able to get to what I thought was slide 2.
Okay. Oh, well, maybe if it's okay, I'll just do it this way. Can you see it? Is it too tiny?
No, it's not tiny.
Okay, great. So for this, I don't have any conflicts of interest to declare related to this presentation. So to give you an outline of what I was going to share with you today, first, I want to talk about we still have an epidemic, particularly in the United States and many other Western countries in terms of the opioid crisis that we are facing. And so I wanted to talk about that epidemic in the pandemic. should also provide some considerations and concerns related to those individuals that have substance use disorders and their treatment. And then also talk about recovery and how we can help parents and caregivers who have substance use disorders help their children. And I broke it down into different age categories. These age categories could be broken down into a variety of different ways, but these were just the ones that we had talked about in the committee meeting that Carrie had referenced in terms of developing a toolkit to help parents and caregivers with their children, and those parents and caregivers particularly that have substance use disorders or in early recovery or even later recovery. And so one of the things that is, I don't know why that came up, sorry. So one of the things that has happened, at least in the United States, and I would imagine, while I've not seen data, I would imagine that it's happening in other places across the world too, is that alcohol rates or other types of substance use went up. And so in the United States, March 13th was kind of the tipping point for us where the pandemic was really recognized and lots of things were put into place. And so when that happened, when lockdowns happened, the beer, wine, and liquor sales went greatly up in the United States. And so here you can see that compared to last year, so compared to like March 13th of 2019, by 2020, beer sales were up by 51%, wine were up by 55%, and 35% for liquor. And so also concurrent with that, we also have evidence of increased illicit substance use. And so what this slide shows us, these are urine positivity rates for cocaine. For cocaine is in the green, fentanyl is in the orange, blue is heroin, and methamphetamine is the gray. And so here we are with the urine positivity rates. So these are urines collected in treatment programs. And you can see they're pretty small, like 0 to 1%. In January and February. But when March hit and the COVID-19 pandemic hit with on March 13th again, you can see the rates just really increased, almost 32% of an increase in April and May overall. And so those are just objective data to show that while the lockdown was happening, there were increases in evidence of substance use. And not only
I'm sorry, Dr. Jones, I just had a comment or a question, or I don't know which, but it just occurred to me as you're saying that I don't know how this is being affected by the pandemic or people being home, but even employment testing. I don't know if people who are being, are normally tested on a regular basis in their employment, if they're working from home, I don't know if that's still happening or not.
Yeah, that's a great point, and I don't think I've seen any data on that.
Yeah.
But I think you're right, and I think there was such a disruption in routine, and one of the things that we know about substance use disorder treatment and that whole relapse prevention is making sure that we're keeping that routine. So if you don't have those same numbers of random drug testing that is happening, right, that could be an opportunity for people to return to use. Because that sort of parameter, that contingency isn't there like it used to be. Great point. Thank you. Yeah, so anyway, so overdoses have also grown, unfortunately, and again, these are data from the United States. I would be very interested to see data from other countries to compare and contrast, but certainly what we know is by May, there was over a 50% year-over-year increase in our overdoses. And I can also tell you, even from the Horizons program, we are seeing many more fatal overdoses, not of women that are in our program or even recently completed our program, but women that have been well stabilized into the recovery for like 3 to 5 years. And unfortunately, they became incredibly destabilized during the pandemic, and we've lost many lives. And so let's think about why that might be. And so this slide really shows all on the left-hand side what we have to do for COVID safety, right? So we've all been told that we need to socially distance. We've been told we need to isolate ourselves. And then, of course, if we test positive, we need to be in quarantine. And those things, even for people that are very high psychological functioning. Even everyone has been incredibly stressed by this pandemic. And so when we have folks that have substance use disorders that might even have been in recovery for many years, there's still a susceptibility to negative emotions, to fear, to anxiety, to irritability, to sadness, and to boredom. And if we don't have really positive and strong coping mechanisms, what those things can do is be triggers for a return to use or even an escalation of use if you're still actively using. And so thinking about, so often what we need to do to keep people physically healthy is sometimes the worst things that we can do to keep people psychologically healthy. So what can we do to help people overcome and manage that? And we're going to talk about that in just a minute. And so COVID really created this perfect storm, right? So we're alone, we're socially isolated, many people lost their jobs, they've got this extra financial loss and stress, they're worried about their health, they're worried about their loved ones' health. So many people lost activities. Your children couldn't graduate from their respective grades. Sports activities went away, there were no national sports. We lost even being able to hug our loved ones or see our loved ones. So we had increases in psychiatric symptoms and psychological distress. And then for folks that live on the edges and what I would say the margins of society, they live in a pretty fragile support system anyway. And when the pandemic happened, many things just closed. Organizations closed their doors, businesses closed their doors, access to medical care and community support became much harder to access, if not impossible to access for at least a period of time. And so after the WHO declared that pandemic on March 11th in 2020, we can see that we heard many reports of substance use programs just being stopped. They had to figure out, what are we going to do? How are we going to do this safely? So admissions either stopped or greatly reduced. Support agencies, which are such a vital part of the community network for substance use disorders in terms of a recovery-oriented system of care or part of treatment, shut down. One of the things that did happen that we started to hear more about were phone interventions. It came more online. There were apps for your phone that became much more in vogue, and I'll talk about those in a little bit. And there was definitely this consideration for what do we need to do to help people get access to technology, because even though there were all these apps and all these different things that were coming online, if you don't have a phone, if you don't have a data plan, if you don't have minutes, all of those things become impossible for you to be able to access. So while there are many different mutual aid support groups, we have to think about how to help people actually access that in low-resourced areas. Some of the things that have also come out during this time in talking with programs that work directly with children as well as mothers and fathers that have substance use disorders is making sure that they really understand what the accurate facts are. And I think we can all benefit from accurate facts during these days. But so some of the treatment programs that I've been talking to heard how much and hearing from them how much harder they have to work to dispel myths and make sure that they're giving accurate facts to the families that they're working with. And so making sure, and this comes from the WHO, so making sure that we're telling all of the people that we're working with that substance use is not going to protect you from COVID-19. If anything, it can make you more vulnerable to getting sick and to not being able to recover as well from COVID-19. We know that, we want to make sure that people have other psychological tools and don't use substance use as an ineffective coping mechanism to deal with fear and anxiety and social isolation. We certainly also know that people that have substance use disorders can be more vulnerable to COVID-19 infection, given if they have problems with lungs. We know so many people are smoking that also have substance use disorders or are in recovery from substance use disorders, and that the treatment outcomes with COVID can actually be worse for those that have substance use disorders. And so we need to do everything we can to help make sure that the people that we're working with have that accurate information. And so we also want to be able to promote the health of those that have substance use disorders. And so, making sure that we have signs up everywhere talking about hand washing, talking about wearing masks, that physical distancing of at least 6 feet, and that we are regularly cleaning and disinfecting surfaces where we can. In addition, and specific to those that have substance use disorders, making sure that they still have access to naloxone is incredibly important, and not just that they have access to it, they also know how to administer it to their loved ones. And then there's also been talk at the WHO in terms of making sure that we have an accurate way to recognize those that have COVID-19, because amphetamine-related issues can create hyperthermia. It can give people fevers, and so that could be a misdiagnosis of COVID-19 when in fact it's not. It's actually the substance that they're using. And so what else can we do in terms of substance use disorders, and this is mostly specific to opioid use disorders for our parents, is do everything we can to make sure that their medication to treat opioid use disorder is not disrupted in any way. One of the nice things that happened in the United States is that some of the regulations during this emergency time were loosened so that we could give more take-home medication for methadone, for example, for a longer period of time. There are also doorstep deliveries where there's touchless deliveries. Pharmacies can deliver medication. And then also making sure that we're communicating and over-communicating in this time. So phone calls, video chats, memos, flyers under the doors, whatever it is that we need to do to really make sure that people are getting the information that they need to be able to take care of themselves. As well as making sure that we're looking out for interpersonal or domestic violence signs. When as a lot of the treatment moved to the virtual world, to Zoom and meetings and WhatsApp and all of those sorts of things, oftentimes, in particularly women, might not have a say in how they're receiving their services, and they also might be overheard, which could really threaten their lives. So making sure that we have good safety protocols in place to keep people as safe as they can during this time from abusive partners. And so what are some of the things that we can do around that? So having a friend system code word is one of the things that we've been talking to our women about. And so that's to make sure that there's like a word like peaches, that if someone gets in trouble and that there's an escalation of violence or abuse, that they could literally call their friend or text their friend or have a message delivered to someone with that code word, and then that safe person would know what to do to help get that person out of that domestic violence situation. We also talk about the safest room, which even if you're living in one room, what is a safe area in the room where maybe violence is less likely to occur, or if you have the luxury of having multiple rooms in your living situation, is there a room that doesn't have weapons or anything that can be used against you? Is there a way to escape by a door or a window or something? And planning with children. So maybe not teaching them code words, but teaching them nonverbal cues for like a mom opening her arms to say to the child in a nonverbal way, come to me, I'm safe, to get away from the violence. And then being able to plan with children about, what might happen if they needed to leave, but doing that in a way that will not put the children at harm too, because if if they were to disclose something to the abuser, it could be really dangerous for the children. Notifying the police before an emergency. So what that really means is making sure that you're raising concerns. You're saying, I am concerned for my life, or I'm concerned that violence is escalating. And I know that that is maybe not the best thing in all places, depending on the context of the police. Some police departments even have domestic violence units, and so, or more like a social worker type person that can help. And so reaching out to that resource can be helpful. Having an exit plan, so knowing who can help get you out, where you could go, and then do you have those food, supplies, medication, documents are really important. Even having an electronic copy that's kept somewhere else, not on site or on your person or on your phone or computer, if you have a computer. Having that bag packed of just the very basic essentials, and maybe that bag stays someplace else, which would be part of your exit plan. Making sure that you have those important documents, seeking social support where you can, even if the women or anybody that's being abused can't get out, having that connection during the day, reaching out to someone else or them reaching out to you to be a support. And then creating a peaceful place, even if it's in your own mind. If you can, we ask, give women art supplies so that they can draw and think of peaceful places, or write and think of peaceful places. And then finally, holding on to that plan, it might be done in code words and tucked someplace like in feminine products, or even just memorized. So what are some other things that we've learned through this pandemic about working with women and with children? It is to limit the consumption of COVID-19 and all sorts of media overload. There is a hyper focus right now on things that can make people incredibly anxious. And so making sure that you're putting down the phone, making sure that children aren't spending a tremendous amount of time on screens or tablets, to really just limit that consumption. We've also found that in the work that we do in terms of the treatment program, that using movies and other multimedia tools on Zoom are less effective than they are in person, and so finding different and creative ways of getting across the same information. Also, too, in this the need to over-communicate, doing it verbally as much as we can rather than written memos, given that there are different levels of literacy, and if we are doing memos, and making sure that we have really clear icons on what we're saying so that people can better follow what we're trying to communicate. Helping people grow their social support network can certainly be a challenge during this time, especially the women that are in our treatment program right now are just reporting real fatigue with the online platforms, and so the last thing they feel like doing is getting on yet another one at the end of the day to grow their network. So are there other creative, socially distanced ways that they can meet people and grow their network? And certainly right now we have a tremendous amount of anxiety for residential programs that, what's going to happen? It's much harder to get a job now. It's much harder to find housing. And so dealing with that anxiety and being creative with giving different ideas. Also, too, thinking about in that virtual world, how can women be safe in their environment, or how can a caregiver be safe in their environment if they're still continuing to get that ongoing support or need that treatment? So putting headphones on, making sure that there aren't children that can hear the words that they're saying, or at least limit the words, maybe using the chat box more, can also be strategies. Also, too, being really flexible during this treatment planning time. Transportation can be an issue, especially in places where there are lockdowns, they can't get there, and so being flexible in appointments can be important. And then being really vigilant for abuse and neglect of children, which we'll talk a little bit more about in a minute or two, just in terms of ways to help support parents in finding joy in their children and reducing their stress and being in the here and now. So some of the things that the women have shared with us in the program is that during this time, during this lockdown where people can't go out, is that sheltering in place has been such a trigger for their isolation is coming back, because addiction is so much about isolation, and the opposite of it, the recovery, is about connection. And so how do we maintain those connections, and how do we really tap into those coping skills that can help us understand what we're feeling, respond to what we're feeling, without having to respond to that in a return to use kind of way. Being able to just get out and walk around, if you're able to do that during the, wherever you are, having tools to work on education from home. There's so many different things that if you have the luxury of having that ability to be online, there's a lot of things, education for children as well as education that you can learn that are free. Khan Academy is an amazing thing for children. And then women also asked to please be patient with us and have empathy for us, because sometimes they need a break from their children. And I think about, all around the world, families that are isolated, living together 24 hours a day, now for months on end. How can we help our parents step away and take a little break? How can we help the kids step away and take a break? And then I guess, too, the fact that isolation and discrimination and stigmatization is alive and well during the COVID pandemic for those that have substance use disorders. So now let me turn to talking a little bit about specific ways to help parents and caregivers and through the ages. And so I want to say first and foremost that when we talk about parents and caregivers that have substance use disorders, that recovery must come first. Because if they are unstable in any way, they're not going to be bringing their best selves to their children. So anything that they can do themselves to empower themselves to be in recovery. And when I talk about recovery, These are these 8 dimensions of wellness that have been defined by the Substance Abuse and Mental Health Administration Services for the United States government. And so we think about the environment. So what is that good health, outside of us, that what stimulates our well-being? And then thinking about that internal environment, that emotion. So how are we coping effectively? What are those tools that we have in our toolbox that can create healthy emotions and then create satisfying and nurturing relationships and supportive relationships? Thinking about financial, and I know during COVID-19, the financial stress has been absolutely unbelievable and unbearable for so many people. So where can we find that financial stability, or at least a little respite from that stress? Socially, making sure that we have that connection, because recovery is connection with self, connection with a higher power for many people, but not everybody, and connection with others, including children. That spiritual purpose that is very important to so many people that I know in recovery. The occupation, which again goes to the financial, they kind of go hand in hand, but making sure we have a purpose. That physical piece, so that we're getting enough sleep, that we have a healthy diet, that we have good hydration, and then that intellectual, recognizing that creative way that we're learning every single day in some way. So those are like the foundations of recovery. And so what can we do to help parents find that and then be able to be more stabilized? And just some really simple things that people can do even when you're in lockdown or isolation is keeping a gratitude list. That goes back to the thing that I said in the very beginning in terms of, where are the things that are going right? It's super easy to list all the things that are going wrong, but when we intentionally, repeatedly look for things that are going well, that can actually change your brain. It can change the way you're thinking. And so the more that the parents can do that and can help engage the children in doing that, the better everybody will be. Keeping a recovery journal or a log, creating structure. You're going to hear that probably in every other slide that I'm going to share with you today. Structure is so important. I remember one time that in Brazil, when I was visiting an adolescent treatment center, and the young man who was showing me the whole treatment center opened his closet, and his closet was incredibly, impeccably well organized and put together. And he said, "My closet is my recovery. I need that structure." So keeping that structure of keeping things in place and keeping a routine for your day. Routine brings predictability. Children crave and need that predictability in order to learn and to thrive and to do well. And so making sure that we're creating a structure for ourselves as parents as well as for children. Practicing self-care. So that can be anything from a 10-second meditation in the morning to taking time to make sure that we are, washing hands, keeping ourselves clean, brushing teeth, whatever those things are, but finding that way to take care and renew ourselves. For some people, it's connecting spiritually to that higher power. So carving out that time during the day to do that. Sleep has been so stressed and challenged during the COVID-19 pandemic, as has eating and exercise habits. If you can't go outside, so figuring out ways to have a good sleep hygiene. So we talk a lot to the parents that I work with about what do you need to do in the room, just, in terms of, can you adjust temperatures in any way? Can you create like a little sleep mask so that the light is blocked out? What are those tiny things that you can do to help yourself get a better rest? And then also too with exercise, you absolutely don't need any piece of equipment at all. There's so many different body weight-bearing exercises that you can do. Just doing jumping jacks can be something that can help get the blood flowing, can help get the lymph system going, and can be a really positive thing. And then also completing a recovery capital scale. This is something that's available online. In fact, everybody can do this. You don't even have to be in recovery. But looking at those 8 dimensions of wellness that I mentioned earlier, and so how would you rank yourself on that? What are those things that you're doing well? What are those things that you see that you get lower scores on your self-rank? And so then developing a plan about how to strengthen those. And then finally, there are so many online apps. There are things called Pocket Rehab, I Am Sober, and In the Rooms are 3 that tend to be very widely used. And so literally 24 hours a day, you can go attend to any kind of meeting, support and recovery meeting, all over the world. And that's actually been one of the things that the women that I work with really like. I also want to mention when we start to talk about children and parents that we have to start from the very beginning, which is pregnant women. And so there's data that's constantly emerging around COVID-19 and things to know if you're pregnant. This is just one thing from one flyer from the March of Dimes in the United States. And so, obviously everything we do is non-pregnant patients. We want to still be doing as pregnant people. So making sure that we're practicing social distancing, hand washing, mask up, all those types of things. But also, too, to make sure that if you have a pregnant person that you're caring for, then making sure that they know what to expect when they go to whatever birthing facility that they're going to. Are they allowed to bring visitors? What's the stance on mom and baby together? In the very beginning, there was an automatic separation. Now we've learned we don't have to do that, thank goodness. And so that's better for mom and baby. Can you have a doula? Who's allowed in the labor and delivery room? And what are those, or if you can't, can you FaceTime? What are those types of things that you need to be aware of? Also, too, making sure you know who to call if you go into labor and delivery, making sure that you're doing everything that you can, or the pregnant person's doing, postpartum person is doing everything that that can be done to enhance the health and well-being of the baby in terms of frequent hand washing and masking. There are recommendations around breastfeeding and making sure that we're cleaning any kind of breast pumps incredibly regularly or frequently. Helping our pregnant people reduce their anxiety. Anxiety is really not good for pregnant patients. So we want to make sure that, what are those small things that we can do to help reassure them, to help bring predictability and structure to their lives. And making sure that our pregnant people are not isolated, that they're talking to people, that they have that perceived support, that there's that good old daily routine again, that structure, making sure that they're drinking a lot of water and getting as much sleep and rest as they can. I love this graphic that I saw. This is actually a picture that I took, and it says, "I wear my mask to protect you. You wear your mask to protect me." And I think when we're talking to parents and caregivers to help children, modeling is such an essential component to positive parenting, right? Because children are watching us all the time, and they might not listen to our words, but they certainly are going to watch our actions. And so when we wear our mask, this can really help them know that it is safe and okay and acceptable to wear a mask too. And so, it's also helping children to understand that, yeah, I'm mildly inconvenienced. This is not fun to wear a mask, but we're going to do it because we have empathy and we care for other people. So more about routine, and I cannot stress this enough during the pandemic. It is essential to have this routine. And no matter what age you are, from, even newborns need a routine all the way up to 18-year-olds that are still in our care, or even 25-year-olds that are still in our care. We need a routine. And so rather than a top-down approach, which is we are going to mandate the routine, especially for kids that are the preteens up through adolescents and teenagers, getting them to help think about how that routine should look. So making that a fun family time where we can talk about that routine and engage them in it means like they're more likely to participate in it. So, some essential structures around that routine is the meal time. Eating together can reduce isolation and loneliness. And then also taking that pledge to only talk about positive things or supportive things and not take the opportunity at meal times to tear each other down. School time and home time and help time. So finding a place where in the space where you're living, where children can complete some learning every day, even if it's just a little bit, if they can have their own space to create that learning and do that learning, that's really helpful. And then also giving children specific concrete tasks to do can help them feel a part of the family and as if they've contributed in some way. And then making sure that the other piece of our routine is that social, free time, and family routine. So designating a time every single day, even if it's only 10 minutes, to talk to children, to move our bodies, to do something fun together, to be together emotionally and physically, and be present and see and hear and value each other is incredibly important to thriving during this time. And we all need play. And so making sure that that connection is happening. So taking 20 minutes each day to just put down the phones, put down the tablets, turn off the television, and just be together. Give that child your undivided attention. Let them lead the activity. You don't have to be in charge. Let the child lead the way. I was just talking to a woman earlier this week, and she's like, I tried this, and it was amazing. Like, I had the best time with my child in a time that she had not had a good time with her child in a long time. So being that emotional, physical presence is just so essential. As part of what Horizons has done is created 155 days worth of mommy and me tips. These could be caregiver and me tips. And they were non-technological things that children could do. And so this one is just an example of putting 26 sticky notes on the floor, little pieces of paper with a different letter. You can place the sticky notes in random order on the floor, using even a sock to just help the child stand behind and toss the sock onto a letter. And say, like, toss it to letter A, and they can toss it to A. Or you can even have them toss it and then say an A word. So there's all sorts of really simple things that can be done with very limited materials, but it's a way to interact. This is another ball catch activity. Making letter cards with the child can also be fun. We also have 155 staff activities to help people survive through this time. And so this one was looking at meditations. So let's talk a little bit about 0 to 3-year-olds. What can we do? That structure for playtime is absolutely essential. So, there might be just having the baby on a tummy time, on the floor for tummy time, and or having them, put an object a little bit out of their reach and having them grasp for it if that's developmentally appropriate. And then anything up to, playing with simple pots and pans, whatever's in the house that's safe. Those things can become items that they can play with, that you can play with them. So making sure that you're having mealtime together, that it becomes a structured routine. Maybe the 3-year-old can even help set the table. Having that sleep routine so that there's a predictable, toothbrushing, bath, and you read a book. And that can start as early as, their neonates. Making sure that we're avoiding screen time, particularly for our very young people. We're doing this huge world social experiment with screens, and we certainly are hearing more and more the need to avoid screens and for very young people. And then finally, what you say and how you say it matters. There's been some really wonderful work that came out of Kansas years ago that showed that one of the most important things was the ratio for child development, how people were going to do in terms of their relationships later on, their physical and emotional health later on, the type of employment they got later on. What mattered most was the ratio of positive to negative talk, and the greater ratio towards positive talk compared to negative talk, the better children. We can do it in respectful ways. And we also need to notice that they are doing well and tell them what they're doing well. So for 4 to 7-year-olds, again, that playtime, making sure that you're doing something developmentally appropriate with them. This could be singing songs, telling stories to each other, making sure that the children have some type of school time so that they're learning something new every day, even if it's not for a long period of time, because that's not possible. Mealtime, they can absolutely help prepare things for meals. So involve them, make them feel a part and a purpose. Again, keeping that sleep routine. This time it might be changing as the children are getting older. But again, you can even use this time to talk about 3 good things for your day before they go to sleep. Limiting the screen time, and then again, that positive to making sure that we're erring on the side of more positive to negative talk. When we get to our 8 to 10-year-olds, again, the same sort of thing. So this time playtime, if it's possible for them to see a small group of friends that are in your safe COVID bubble, that is great. It can be really isolating for all children. Then making sure, again, they've got that school time, the mealtime, they can even start to do even more complex things to help out, but not dumping things or giving children too much responsibility, but making them feel a part of the process. It's really easy to sort of be a little more lax around sleep time, and children as they get older still need a very, well over 8 hours of sleep every night, making sure that you've got that limits on screen time, and that you're giving children opportunities to do other things so that it's not the only thing that they have as an option for interaction with someone or something is their screen. And then thinking about our 11 to 15-year-olds, social time, you know, so often I hear that these age groups get kind of lost in terms of social, and not even socializing as much with the parents and the caregivers, but they really desperately need that time socially with peers in their own age, because this peer group becomes so influential with them, and making sure that they are also engaged in school. Maybe they're thinking about different types of careers that they want to do. So making sure that they're starting to think about their future and creating a future life plan, and using this time during COVID to do it. There's all sorts of time that we have now to really think about what we want to do and explore what we want to do. So giving them a hope and a sense for the future, and making them, again, feel involved in family is incredibly important. It's really easy for teenagers to get out of good, healthy sleep routines. I can't tell you how many people I've heard of where their kids almost have this reverse night and day flip. So making sure that we are keeping that good up and moving around during the day, interacting during the day, making sure they're getting exercise is really important. And it's even easier to sort of be lax on screen time. So again, you know, what can we do to get rid of the electronics and have a conversation? Table talk. So I think one of the most important pieces of furniture in people's homes is the table. And so we use this as an acronym to remind families to engage with each other, and that is table talk. So at our table, we are going to T, turn off the electronics, A, ask open-ended questions, L, listen to what each person says, and then finally K, be kind and respectful to each other. So starting meals with gratitude, making a positive zone for mealtime, and then as parents, modeling that empathy, patience, and compassion for each other. And so I'm going to end here the last couple of slides with mental health tips that I think we can all use as not just as parents and caregivers, but also as professionals and just frankly human beings, right? So we all need to focus on getting enough sleep and making sure that we have our own structure and routine. 2, avoiding that negative self-talk. So, you know, definitely the parents that I work with that have substance use disorders and are in recovery have a lot of negative self-talk that we work a lot on, but we all do, right? So not getting into our head about what we should or should not be feeling, just leaning into that. Taking a mental vacation from catastrophic thinking. You know, there's lots on our phones these days or in, you know, different sort of social media that can tell us all sorts of horrible things. So giving yourself a break from that catastrophic thinking. Taking things one day at a time, being more present fully, physically, emotionally in the moment can also help be a way of reducing anxiety. And making sure sometimes, you know, the distractions are okay. Sometimes maybe I do just want to like spend an hour on Facebook, and that's all right, and I'm going to give myself permission to do that. But then after that, I'm going to put my phone down and I'm going to do something else. And to make space and process what you're feeling. It's very easy in this day and age, especially as mental health and substance use disorder treatment professionals, to run and run and run. You can have, you know, 20 Zoom calls in a day, for example. So we need to like space that out and make space for ourselves to recognize and process what we're feeling. And making sure that we're going out of the way to notice the good and communicate that good to other people and to ourselves with our positive self-talk. Thinking about changing those social media habits. So there's an app called Moment, which can tell you how many times you picked up your phone, how long you spent on your screen each day, and that can be a helpful way of reducing the number of times that you pick up your phone and limiting your social media consumption. And then finally, creating a moment every day where nothing can go wrong. So it's giving yourself that permission, if it's in the beginning, the middle, or the end of the day, to just be and be safe and know that it's okay. Last thing that I have to say is about dealing with Zoom fatigue, and I know that we're all on this WebEx training right now, but making sure that, you know, there's a real reason why you're feeling even more exhausted than ever. Yes, it's the stress of COVID, but it's also the stress of looking at what one of my friends calls an unblinking eye all day, that camera that you talk into. So some things that you can do is you can not look at your face. You can hide that self-view that can be helpful, making sure that you're spacing encounters more. And also, too, if there's any other way to use anything other than a device for your social connection, take advantage of that. Even using the telephone can sometimes be helpful. Yeah. And then making sure in between every meeting that you have, move around. Even if you only do 10 jumping jacks or a plank on the floor, there's something that you can do. So in summary, just because we have a pandemic does not mean that the epidemic that is raging in many places around the world with substance use disorders has gone away. If anything, COVID is like a bright spotlight that highlights it. There are certainly many considerations and concerns related to COVID-19 and those that have substance use disorders and how we need to think about treating them, and certainly making sure that we're giving them accurate information is really important. And then there are big themes, regardless of how old children are, that parents and caregivers can do to help promote resilience and well-being during this time. And that having that structure and being physically and emotionally present are two really important key things. And with that, I will thank you very much.
Thank you. That was so good. I learned a ton. We have a couple ways that people can ask questions. They can put a comment in the chat and I can read it out, or if they want, I believe people can unmute themselves or they can raise their hand and I can unmute them in this setting. So if people have questions, please take advantage of this 10 minutes that we have the amazing Dr. Jones to ask whatever you'd like, or if you have comments about ways you're handling things in your area, I know we'd be interested in that as well.
Yeah, that'd be great to hear.
I realize, as you know, I have 2 young children at home and we're doing e-learning and it's challenging. And I used to be so good about the table, about always making sure, and I'm realizing that I need to get back to that about, we would never have screens at meals or things like that. And I've gotten definitely more lax.
Yep.
One of my favorite things to do over dinner is to do something we call roses and thorns. Mm-hmm. And so I asked my children to tell me a rose from their day, so a good thing, and thorns, so something that wasn't as good. So it gives them an opportunity to talk about gratitude, but also to share something that, maybe they wouldn't normally share with me, so I know where their mental health is at, where their head is at, and then also I use it sometimes, especially with my younger one who tends to be a little more negative. I'll use it as, sometimes they'll say, it was all thorns. And I'll say, what about when we played tag? Oh, yeah, well, that was okay. What about when your grandparents called? Yeah, that was pretty good. So it's a reframing tool for us at home as well.
Yeah, that's great. Yep, I love that balance of, good and not so good can be really helpful.
Yeah. But, I was just going to say, sometimes doing that with, especially maybe like a teen, if you do roses and thorns and they say, I got in an argument with a friend or something, they may not share that with you, but if you're doing it in that way, that's more of a routine and a structure and a habit, like you mentioned, they just kind of share. It's not like you being like, well, what's going on? Is everything okay? Right. It's a little less invasive, maybe, is a way to say it, because we kind of do it like a little game almost.
Yeah, and it's funny. So my children and husband and I all do 3 good things about our day, and we have literally done that since my son is 14 and he was 9 months when we started.
Yeah.
And that's our dinner time routine. That's what we do. 3 good things. Yeah. And, there's research actually to show, of course, I know you know this, that gratitude completely changes your brain for the positive, right? It literally changes your brainwaves. So I think that's amazing.
It looks like Ren's Dave Albe has unmuted. So I don't know, Ren, did you have a question or a comment?
Hi, good day. Yes, I have a question. My question. Hi, Dr. Jones. Hello. Nice to see you again.
Good to hear you.
Yes. Thank you for the very summary list of tips for parents. I have a question though of if you have anything in mind for parents who cannot be with their children because they have to be in a residential treatment during this time of pandemic.
Yep. Great question. Great. So how can we keep how can we help our patients that are in residential treatment stay connected to their children at times when, for months, that they literally physically cannot see them or touch them. And I think we can learn a lot from, the experience parents have had in incarcerated settings. So, recording stories for them, if that's possible, if they can send handwritten notes or handwritten letters or handwritten stories, if it's possible to take pictures, like the parents could take a picture and send to the child, or can the child take a picture, can the child draw pictures? What are those ways that we can use sort of old-fashioned the mail to be able to stay in contact, or if, parents are lucky enough to have devices and children are lucky enough to be in a place for their devices, then, staying in contact at least that way can be helpful. But it's definitely, but even by phone contact, even if that sort of visual virtual world isn't available, but making sure that there's, are there little things that can be sent through the mail is probably the best thing that I have. I don't know if other people have ideas.
One of the concerns of some of our clients in treatment who are in residential facilities, they become really demotivated in treatment.
Oh, Randy, you there?
I'm sorry.
Oh, yeah.
Yeah.
It just out for a moment. Sorry. You were saying they were demotivated?
Yes, because the COVID situation is causing them a lot of anxiety. Well, not primarily for themselves, but for their children. So, do you have anything? How can we help them manage those anxieties?
Yeah, so the very most simplest technique that can be helpful for just handling some anxiety can be the breathing techniques, because it requires absolutely nothing that costs any money. It's just your breath. And if you're not familiar with box breathing, that can actually be something that can be done any time that can help kind of reset the nervous system. And so box breathing is for a count of 4 breathing in. So you breathe in, you breathe in for a count of 4, and then you hold the breath for a count of 4, and then you breathe out for the count of 4, and then you hold your lungs empty for a count of 4. So it's like a box, right? Breathe in for 4, hold it for 4, breathe out for 4, hold the emptiness for 4, and back in. And doing that repeatedly can be one way of reducing anxiety. The other thing there are lots of other things to do in terms of if folks are literate and can write and can journal about their anxiety, that can be helpful. Even if they are not literate, drawing pictures of how they're feeling, or making some kind of art activity or art creation about how they're feeling can be helpful. Maybe putting out what their biggest fears are, and sort of just trying to get everything out, or even talking about what their biggest fears are. And then, what are the things that they can control right now? What is in their sphere of influence that they can do, are some small ways that might be able to help.
Thank you very much, Dr. Jones.
Thank you, Ren. It's great to hear your voice.
Do we have any other questions or comments? We have a couple of minutes left. That was a really good discussion. Thank you.
So just as we're waiting for any other questions to come in, just excited to share that we will have a toolbox. Oh, and also too, to give a plug to UNODC and their toolbox. It's Listen First. If you have not seen their website and all of the tip sheets and things that they have have general tip sheets, and they also have one specific for COVID-19. I believe it's more around prevention and not so much dealing with people specific to substance use disorders. And it's also, all of those tips can be really helpful for all parents and children. So I would give a shout out to that for sure.
Excellent. Great. Yeah, seen that there's a lot of resources, maybe not completely in this category, which is why we're working to create some, right? So
exactly.
but we did see that there were a lot of things that you can pull together if you're looking for things in this general area, just about, and obviously we know using mindfulness, just looking at techniques for mindfulness and mindfulness with children, and can be really helpful globally. So
absolutely, yep. And actually the child protocols that we have, the Suitcase for Life, has some very specific techniques for working with children between the ages of 4 and 12 that can help them reduce their anxiety and also think and plan for the future. I mean, I think that's one of the things that has been such a challenge during COVID, is what is there to look forward to and what kind of hope. And even playing a game of, when COVID's over, the first thing I'm going to do is fill in the blank. When COVID's over, the thing that I'll most look forward to doing is blank. So you can come up with a whole set of questions that can help children dream about the future.
Yeah, something to look forward to is a big one. And, even if you can set up little things to look forward to during this time, right? Whether, like you said, if you're able to have a visit with small, you have your little bubble, you're able to have a visit with folks within that group, or if you have game night, or if you have something that, because I do think that having something to look forward to, having some hope, it's really important for all of us.
Exactly.
All right. Well, on that note, I'm going to thank you and thank everyone who was involved. It's so great to have you all here, and I am sure you all learned a lot, as I did, and we're so fortunate to have Dr. Jones as part of our team and as part of our, being in this field with us. So we thank you for your time and your patience with me.
No, thank you so much. Bye-bye.
And if you all know anyone who would like to see this, we will be posting it on the ICU DDR website. So you will be able to share, or if you lost connectivity at any time, or if you want to, if there's any part of this video you want to see again, it will be posted, and by sometime next week it will be up on the ICUDDR.org website. So thank you all, and take care. Oh, we have a message in the chat. All right, I'm going to stop our recording and say goodbye. Thanks again. Oh, thank you very much for the talk, Dr. Jones. Be safe and well, everyone. That's our nice chat.